because, and it had a lot of traction because it fit in with the kind of already present homophobic atmosphere at the time. I interestingly found a study that was done in 1985 that looked at the early 80s in New York of who was dying. And that referred to, there was lots of anecdotal evidence of what was called junkie pneumonia. So people, injecting drug users had been dying in like the late 70s, early 80s from pneumonia, which of course we would now know to be pneumocystis pneumonia, which is one of the opportunistic infections that someone with advanced HIV infection would get. But they actually made up the vast majority of the people that were dying in New York City. It's just that people weren't taking notice. So there's like this one narrative where it takes a long time for the media to take notice of the gay men that were dying. But also when people did pay attention to it, the fact that they could call it a gay plague and it was gay men that were dying, it was just that they were the most visible deaths, if that makes sense, which was really interesting. Yeah, but you know, that's globally.
In our excitement, we forgot to tell you what we're actually going to cover in so yeah, so these are the areas we will cover throughout this evening, and we have got, you know, for a pandemic that's gone on for 40 years, I know we're already focused on a bit, we haven't got a lot of time. So
yeah, so we're going to look at public awareness campaigns in the UK, and safer sex campaigns within the UK, government responses, community responses, HIV care and treatments, and we'll keep that as Leeds focused as possible.
Yeah.
Questions?
If there's any kind of terminologies that you're not aware of, then just stick your hand up and we'll clarify those, because sometimes, you know, we'll try and explain them as we go along, but because we work in that area, sometimes forget our familiarity with certain things and other people aren't. So yeah, don't be afraid to put your hand up.
Yeah.
And then there'll be opportunity at the end as well.
Yeah.
So we're going to play you. I love this piece from this guy called John. So it's just 2 minutes long from West Yorkshire Clear Stories.
1981. I used to come from home to Leeds, swine get to the station. And on the corner
There we
of
go.
the yard and I was
Turn
playing
it so
yard,
far.
there was a bookshop.
The speaker's turned it on.
Bluetooth connected.
Dirty. The Comics magazine.
Do you want to start it again?
One day, one of these magazines caught my eye. It's a magazine. 1981. I used to come from home to Leeds, up Swinegate to the station, and on the corner of the little yard, I don't know, it was Blade's yard, there was a bookshop that sold dirty, the Comics magazines. One day, one of these magazines caught my eye, and for some reason I bought it. And in it, I learned about AIDS for the first time. It wasn't called AIDS then. Gay plague, I think, called it. It later became H3 and then H4 and then HIV. This article mentioned this disease that was affecting the gay population in California and America. And it described it as a nasty disease and people were dying from it. But it wasn't widespread, it just got back to a certain area, and as they put it, it was as rare as rocking horse shit, so there's nothing really to worry about. Well, following on from that, you started seeing snippets in the main papers. You'd heard about this disease in America, and this disease in America was going around male saunas, and Ronald Reagan didn't think much about this disease, and he didn't do anything about closing these saunas. And it was a nasty disease. There was no cure for it. People were dying from it. And other people could catch it besides gay men. And all these little things in the papers, not a lot, but if you were a gay man and you were looking out for it, you noticed them, you took notice of them. Well, I think the watershed moment was when Rock Hudson died. That was splashed all over the front of the papers. I think November, October 1985. Rock Hudson dies of AIDS. A picture of Rock Hudson, 59, a wizened old man. That can't be Rock Hudson, the film star, surely. He's a handsome young man. He's not gay. And I think that was the watershed moment when people took note of the fact AIDS existed, homosexuals existed, and it had to be talked about. Prior to that, homosexuality wasn't mentioned.
Yeah, so there's loads to like unpack from what John's saying there. I think one of the things that I find most interesting about that is that John gets the information very early on from the gay publications that had been imported usually from America in this erotic bookshop. And really interestingly, that was illegal. Those publications that had information about the epidemic that was happening in America with really vital information, you couldn't get them in the UK, and it was illegal to import them because the government had banned it. And I also learned during the research for this that the people in government that were creating the 1986 Don't Die of Ignorance campaign had to kind of secretly smuggle in copies of The Advocate and the New York Native to get information about HIV and AIDS in order to make the campaign Don't Die of Ignorance, which is really ironic because it's called Don't Die of Ignorance, and they've actually banned all the publications that have information about it, and they themselves are having to smuggle it in.
No, it's mad, isn't it?
Yeah.
It's crazy. Yeah. It's a British logic.
Yeah.
So yeah.
Yeah. What about you, Andy? Like, what does that bring up for you? That stuff.
I just love the fact that he's kind of drawn into this kind of, you know, erotic bookshop, and he's kind of compelled to buy this edition of this magazine kind of thing, you know. So yeah, I just love his honesty, and and that perspective from his point, you know, his period of time is very, very, very different.
Yeah.
And so we both watched this. It's still on iPlayer at the minute. It's a Horizon film. And it's set in Greenwich Village, and it's a very informative, for its period when it was shown, it was incredibly informative, wasn't it? Kind of thing. I think because there was many more cases happening in America than there was in the UK to begin with. So they were a lot further along than we were, weren't they? A lot quicker, and we were kind of trying to learn from them. But this was, incredibly informative.
Considering how early on it is, it's called Killer in the Village. It came out in '82. So we don't yet know that AIDS is being caused by HIV. So it's quite interesting to watch the people talk about the different theories they have as to what it is and why it is. And of course, a lot of the theories that gain traction are the ones that play into assumptions that, oh, it's promiscuity, it's anal sex that is producing AIDS. It's quite interesting to see that.
Yeah.
But yeah, so still no mention of condoms or any kind of safer sex messages, but they don't yet know about HIV at that point anyway. So from a UK perspective, obviously we had this very well-known, well-remembered public information campaign, which didn't actually give out much information at all, despite its name. I guess we could play it.
Yeah, I mean, as we said at the beginning, I'm a support worker for Skyline, and even now, people who come in their 20s and stuff will reference this advert. There's something that they've discovered when they've obviously gone home, been diagnosed, and they're doing research on what HIV is, and they come in and they talk about the tombstone still currently now. So it's that fit, and it's it's carving a gravestone, isn't it?
Yeah.
Now I go to become a because a deadly disease there is no known cure. The virus of the virus finds small groups, but it's spreading. So protect yourself. And read this leaflet when it arrives. If you ignore it, it could be the devil. So don't die of ignorance.
Like the funeral bells in the background.
Yeah, so we've got that advert, which, very ironically says don't die of ignorance, but doesn't give any information. And apparently, this is anecdotal and something that I read, Margaret Thatcher edited the leaflet. It was accompanied with a leaflet sent to every household in the UK. And Margaret Thatcher apparently personally went through and removed all references to penis, rectum, and back passage. So any kind of wording that could give any helpful safer sex
information.
Yeah, was removed. And the only prevention information that's in this leaflet says, ultimately, defense against the disease depends on all of us taking responsibility of our own actions. So
make of that what you like.
Yeah, and it says, those most at risk are men who have anal sex with other men, and anyone with many sexual partners. So there's this implicit idea that it's one anal sex or what's called promiscuity. It's almost like producing AIDS, and obviously there's no mention that if there's a condom involved, that risk is virtually limited. So, you know, because they don't want people to be having that anal sex. So
and women can't have anal sex.
Yeah,
So.
yeah. I remember if there's more we wanted to say, but we won't do. I won't show it now because we don't have time. But so that was the first like government funded campaign. But there are other campaigns in America that are also government funded, which
you could show it. It's really short and funny.
Yeah.
Some of you remember this actress from what film was she in?
Oh, the Poltergeist.
Yeah.
And get sick and I tuck you in bed and read you to sleep and make you all better. Well, now Mother wants you to be extra careful when you play with your friends because some of them are getting very sick. Their mothers can't make them all better anymore.
AIDS. Protect yourself and others. Call 800-922-AIDS for free information and play safely. LA cares like a mother.
And one more thing. Help me down. Remember when you played in the sand with the other kids? I got those nasty old germs, and Mr. Soap would grab and scrub them away. Now Mother wants you to play extra carefully because some of your friends are getting very sick, and their mother.
Yeah, and it goes on like that. So yeah, so just that was in 1984. So it's actually 2 years before this campaign was released, and that was paid for by the California government as well. So it's just using humor and using phrases like play safely, just a completely different way of approaching what was happening. I always find it really weird that the government just went for the fear factor, and that's all it.
Well, even in the next slide, isn't it, where it's that one where how big does it have to get before you take notice? As though they've been listening the whole time and we hadn't.
Yeah.
When it was us who had to kick their asses to even kind of listen or acknowledge it was even a thing. So yeah, they're kind of constantly trying to shift the blame.
Yeah. And this, we'll just show this briefly, how to have sex in an epidemic, one approach. This was something that queer communities themselves produced. This was produced in America. And just, it was like a 46-page document, basically, on how to like have all different types of sex in a safer way. So just any kind of practical information wasn't coming usually from governments themselves.
And it was prior to them actually calling it HIV, wasn't it? So they thought CMV was the cause of AIDS.
Yeah, they actually at the time, cytomegalovirus, it's like a sexually transmitted infection. Yeah, they had this idea that they had this theory called overload theory, that they thought that people were getting AIDS because the gay men had had so many STIs that their immune system had just kind of run out of steam and was just so weak that that's why it was kind of running out of, that's why it was fading. But around this time in Leeds, we had a relatively new sexual health clinic set up at the LGI, and someone called Michael Waugh worked there, and he's written a report which I happen to have right here. He was trained in London, and apparently in the late 70s, early 80s, people would go from Leeds down to London in order to get good sexual health care. And so they tried to set this up in Leeds, and it was working relatively well, and people would come from Wakefield and York to see them. And in 1983, Michael was asked by the proprietor of a gay club in Leeds called Bananas to talk to a group of gay men about the new compromise syndrome. And Michael says that what he told them was not well received. Safer sex and condoms were horrible notions to many, and many said it would never happen in Leeds. And he makes the comment, no man is an island, and people, even in 1983, travelled. So yeah, that's kind of early prevention work that was going on, community work, kind of clinicians going out. That's the first kind of contact between clinicians and like gay communities, and not well received. I think people weren't using condoms. It wasn't, that was kind of one of the joys of being gay, that you didn't have to use condoms. And for some people, part of gay liberation at the time was having many partners and not having to worry about things like childbirth. So yeah, not well received, apparently.
No, good old rock shop, for those of you who remember, Maggie? Weren't you here? No. Ah.
Do you remember rock shots, Andy?
I do. I don't remember his talk, but I do remember going to Rock Shots and Bananas.
Yeah.
Which was all in the same kind of building.
I like talking to Andy because I find these things, then I'm like, Andy, like, what was it really like?
And so,
because I'm the young whippersnapper, he calls me.
Yeah, I'm the old boob.
Yeah. I think that's everything I wanted to say.
Yeah, next one.
Another interesting thing that Michael talks about is that before we had a vaccine for hepatitis B, he'd been treating men who would come, because hepatitis B is a sexually transmitted infection that it's transmitted kind of similarly to HIV. It's more infectious, but they had lots of sera, lots of blood saved from those kind of time in the early 80s, and then they found that a lot of people that they'd been treating for years were already infected with HIV for a while. So it just gives a sense of the fact that because it has a long latent period, it was quite widely spread before people started to take notice of it. We've got this leaflet that was produced by Leeds City Council in 1987.
Yeah, so we've got some here, so they're not ones to take home as current kind of legislation on what you should do at work. And so, but then it was sparse, some of the information was okay, but it was, again, not huge, more about washing, nothing about condoms. And so,
yeah.
Sorry, was the advice at the time more about abstinence? That's sort of the general.
It's a good question. It's a good question. It depends who you're talking to, because the whole idea of safer sex was that you just had to alter your behavior and still do the things you enjoy, but just enjoy them in a more safer way. But there were definite messages around the less.
Yeah, there was, because of not past, if you didn't have sex then you couldn't catch it, kind of thing. So there was that kind of narrative as well before the condom kind of realization came along.
Yeah, and you still find that today. I think I supported some students on Thursday last week. They were doing a presentation about chlamydia to a high school, and they said one way to not catch chlamydia is to have fewer sexual partners. So this idea that you're less at risk if you have less sexual partners, when of course that's not actually the case, because you could have sex one time and catch chlamydia, you could have sex 100 times and not catch it. So
and the same would go for HIV.
Yeah.
Yeah, and women, there was, no, but women,
there was a real ugly edge to it all about blaming it.
Yeah, absolutely. But there was a big fight to have it acknowledged that women were being affected by HIV as well, wasn't there? Because they kept kind of just going, it's just gay men, or it's African people, or it's, I mean, for a while it's even called Haitian, wasn't it? Kind of, because it seemed to affect that community more. So, but it suited all the kind of very homophobic, racist kind of bigots that were out there.
And one of the ways people dealt with that kind of tension, where they wanted to kind of moralize it, but then also they couldn't deny that everyone could get it, was that you had then like the AIDS innocents and then the guilty sufferers. So like the haemophiliac children that were getting it, they were innocent, but the gay men that were swirling in the cesspit of their making, they're doing themselves. Yeah, no, but good question.
So this the swirling, there was the kind of background with all the HIV and AIDS kind of narrative and all the homophobia, all the racism and stuff. And then with all the kind of HIV numbers going up, this kind of book kind of tipped Thatcher over the edge. And there was kind of part of the instigation of Section 28, which is the next slide. So, yeah, Section 28. I mean, none of it was ever about promoting homosexuality. It's about promoting information around different choices that people have, or, you know, about different sexualities. So it's completely skewed and twisted. And
yeah, interestingly, I have that line at the bottom saying, nothing should be taken to prevent the spread of disease, which is how I guess we ended up with some safer sex campaigns that do talk about, well, that do represent men having sex with other men, which we'll show in a second.
yeah,
but yeah, it's interesting because I was born in '94, so that's like towards the very end of the crisis years, and so I wasn't alive throughout the '80s. I'm not really sure how people survived it, to be honest.
the shoulder pads.
Yeah, I don't know how. Like, it just seemed like it was just so awful. But it's interesting, like comparing that the Don't Die of Ignorance campaign to the one that was going on in LA. Like the UK seemed to be specifically really quite having a really strongly reactive response to it.
I mean, the church has always had, you know, a big part in our politics, hasn't it? So there was them kind of breathing down governments and everything.
So yeah, this is what I'm talking about. So 1992, this is a leaflet from Terence Higgins Trust. And it's part of a series that they did. And I printed out this copy, which is over there for people to look at. So it's just trying to make condoms and safer sex sexy, basically. Not trying to like bludgeon people into not having sex through like the fear factor, but just trying to say, still have sex, but just do it in this way instead of that way. You know, communicate with your partner. All the things that I still talk about day in, day out at my day job in Manchester now. Like, this is really the start of where we got those techniques from. Terence Higgins Trust was founded in 1982 after Terry Higgins, who was, until very recently, the first named UK person to die from HIV and AIDS in the UK. We'll probably get onto it a bit later, but I don't know if people caught that we had this example of Terry Higgins who died, but then there was this anonymous report in The Lancet, a medical journal, about a 49-year-old practicing homosexual male who also had died from HIV. And it turns out that he was called John Eady and he was from Harrogate. So the first person to suffer from AIDS in the UK was from Harrogate. And that was only discovered in 2021. A relative of John Eady was watching ITV News, and they had found this death certificate that correlated to this person's death, and she was like, oh my God, that's my uncle. And then there's this whole story, so it's very interesting. And he was adopted as well, so it's quite a cute story in that her father, so John's brother, had always wanted to find out what had happened to his brother who had been adopted and left the family, and so she kind of fulfilled that wish as well. Interesting. So we had Terence Higgins Trust, which was an early organisation doing prevention work in the UK, and it was also present in Leeds. And we've got a testimony of someone who was a buddy with Terence Higgins Trust at the time, so who was a volunteer supporting people living with HIV at the time. Other organisations that formed were Leeds AIDS Advice, and MESMAC was a part of that. MESMAC was the first government-funded set of projects to focus on prevention work in gay men, and there was a MESMAC in London, in Leicester, in Newcastle, and in Leeds as well. So it was like a trial community development organization that was about getting people together in the community, talking with them about the concerns that they've got, and then taking collective action against it. So techniques that we still use in community development work today. So we've got a testimony from Tom Doyle.
And then I saw a job for Leeds AIDS Advice, which was a voluntary sector response to HIV in Leeds. And that was from a services coordinator, I think, something like that. And I applied for that and got an interview. I didn't get it. Outrageous. But about 2 months later, I got a phone call from the then manager of Leeds AIDS Advice. So this is a new project we've got funded called MESMAC, and it's back for gay men. Would you apply for that? Because we really like you. So I did. And I became the first outreach worker for Leeds AIDS Advice. Well, it was still the MESMAC project. And so the MESMAC project was the first project of it. So MESMAC stands for Men Who Have Sex with Men, Action in the Community. Doesn't fit the acronym at all, but it's and it was the first project of its kind to get statutory funded for working with gay and bisexual men around HIV. And it was funded by the Health Education Authority, which was then the preventative arm of the NHS. So they're the people who produce This Isn't the Voice of an Actor and the Tombstones thing, and all of those sorts of public information films. And this was MESMAC was the first community response to that. So one of the first things I did was set up an LGBT theatre group. Just because that was my history. I kind of worked in the theatre and all the rest of it. I thought it'd be a really useful way of getting folk together to get together, and that was called Latex Productions, and that ran for years actually. And it was, I mean, just some really, really great stuff. They did some atrocious stuff as well, but most of it was great. Yeah. Other things we did a lot of outreach work in bars and clubs. And that was interesting because at the time we used to get a lot of knockback and a lot of, people thinking it was a bit too much in your face, and we talk about HIV on the scene, and there's a group of just radical gays sort of banging on about HIV and AIDS when if we wanted to have a drink of that. So there's quite a bit of that actually.
So back in the 90s, I was chatting to Tom a couple of weeks ago, and he was saying they were probably distributing something like 500,000 condoms a year in the 90s, and it's now gone down to maybe 350,000. I mean, he attributed some of that because then they were covering Wakefield and Bradford and stuff, where now they don't. It's kind of just the Leeds numbers, but also you were saying that numbers have generally gone down, haven't they, on condom usage?
Yeah, well, yeah, because of things like PrEP, which
and U equals U,
yeah, which, just to like jump forwards a few decades, we now have obviously other tools apart from condoms that help stop the transmission of HIV. So PrEP is a pill that can stop. It's a pill that someone who's HIV negative can take, and it will stop them from acquiring HIV, even without condomless sex, even when having condomless sex. So it's one way to stop the transmission, because people don't always use condoms, don't always like using them, forget, many reasons. And of course, U equals U. So people living with HIV now, it's a very manageable condition. Most people take 1 to 2 pills a day, and they just crack on with their lives, really. It's amazing the medication that we have now, and very little side effects. Obviously, stigma still plays a massive role, and a lot of people still come to see Andy struggling with things around that. And when I was a support worker as well, very similar. I'd have like people in the waiting room coming to see me that wouldn't talk to each other and wouldn't acknowledge why they were both sat in that waiting room, So stigma is still a massive factor, but anyone living with HIV on medication, they have a normal life expectancy. And of course, another massive thing is that they can't pass on their HIV even when having condomless sex. So it's really, really amazing. And that's these two things, prep and U equals U. So it's the fact that people cannot transmit HIV when they're on medication. It's two massive reasons why the numbers of the transmission is kind of reducing so much. And people might have seen the reports, I think it was last year or the year before, that it's now what's called heterosexual contact that's passing on more HIV than than people like men who have sex with men. That's not necessarily because it's risen for this other demographic. It's just that it's dropped so much because of the prevention methods that we've got are so effective. Yeah. So
because the HIV numbers in Leeds were probably less than they were, say, in London. So London had designated kind of wards or buildings for people. Leeds didn't, so people were often integrated into other areas. So if they were presenting with kind of chest infections, they would go on to the ward that kind of supported those people, or further down the line, some people going into Wakefield or St Gemma's, and would be supported by kind of specialists within that kind of HIV field.
Yeah, which I find really interesting, because you hear lots of stories about how other patients within the hospitals didn't want people with AIDS to be near them. They wanted, there was a lot of nurses having to deal with a lot of kind of stigma and fear within the wards, as well as trying to look after people. But yeah, so it's interesting to hear that they were kind of generally mixed in Leeds.
But yeah, and like Tom said, Ed's advice was the initial like community kind of charitable response to supporting people with it. Then THT kind of expanded out of London and did operate from Leeds up until 2007, when Skyline took over the contract from them. But when I first started at Skyline, our manager Becky used to volunteer. She started off as a volunteer, and one of the things that came out of the kind of HIV kind of AIDS crisis was this thing called buddies, and it was literally somebody who would probably get no training and then would be sent around to support somebody at home or in lots of hospital visits to support somebody dying, because that was the prognosis at that point in time, that you were going to die. So she said it was really difficult to keep boundaries because you became so emotionally attached to the people that you were looking after. So she then, from volunteering, she then became a support worker herself, and then ended up managing the organisation. So she's seen like a massive shift in the kind of outcomes.
Yeah, one of the things that's interesting that Becky said, because she also wrote a kind of account of what it was like for her starting in 1998 as a volunteer, and then now she only just left this year actually. Yeah. So she's been doing this work for a long time. How the service itself had to change to reflect the kind of the needs of people living with HIV at the time, and it being quite a big thing, a noticeable change when they started having to provide after hours care, after hours support groups, because people were able to work. So having to do evening and weekend things to have like a wider offer, because people were living longer with HIV now, and that obviously being quite a radical shift once we had the medication. Got something which I really enjoyed watching, I hope you will now, footage of someone doing prevention work, a stall in Kirkgate Market from 1980, can't remember when it was, 1991.
91. Some great hairdos in this.
Wendy Gale, HIV Programme Manager for Leeds Health Promotion Service. This is our Health in the Market stall. We're actually here celebrating World AIDS Day, which is on December the 1st of every year, and this year it happens to fall on a Sunday. I'll just give you a quick guide to what's here at the market stall. We have the resources that we've produced especially for World AIDS Day, which are our condom cards, which you see have a condom inside of them, going down very well. We have free condoms available, which generally free condoms are quite difficult to get in Leeds, so we're providing them free here at the store, and we've run out. We've specially produced condom earrings, which again have been selling quite well. We have a new leaflet, which is all about HIV, which is the basic facts for HIV. And then we have a new directory, which basically runs through all the HIV and AIDS agencies here in Leeds. As you can see, there are actually quite a few of them. We're here for 2 days, and the stall is staffed by HIV workers and health workers from throughout the district. So far, we've had a fairly good response. We've had a couple of negative comments of, oh God, this is disgusting. But by and large, I would say 98% of the people we've seen have been really positive about us being here in the market. We have completed a questionnaire with most people that we've seen, and we hope to evaluate that after the stall. This stall, as I say, is only one of the activities for Leeds HIV Week. There have been many others throughout the week. I'm Wendy Gale, HIV Programme Manager from Leeds Health Promotion Service. I'm here coordinating the Health in the Market stall for World AIDS Day, but there have been many others who have helped us out on the day, mainly staff in the GU clinic, health visitors, other health promotion workers and other...
Sorry, Wendy. Yeah, isn't that great? I think that's really cool. Like, and it's interesting to me, like how similar a kind of stall that we at BHA would do now, just like resources. You know, we're not quite as creative with the condom earrings. Like, we should definitely start doing that.
Yeah.
And even most people being interested and engaging, and then some people making comments saying you're just. Like, I actually had someone say, "Oh, that's disgusting." This was in Manchester Central Library, because 2 weeks ago it was National HIV Testing Week, so I did a stall there. And it was just one person. Everyone else was really happy to engage and to take resources, but it's still that kind of balance. And it's interesting to try and put yourself in the mindset for Wendy Gale and the people working on that store at that time, because it was 1991, so there was still no effective treatment at all. And obviously it's a very different situation, a very different context now for me to be talking to people about the same things, but we know that there's effective medication and other ways of preventing HIV as well. Yeah, there was also Terence Higgins Trust created a very an hour-long kind of film. It's called Gay Man's Guide to Safer Sex. The sound's not very good on this, but I found it on something called Internet Archive.
Sí, es complicado y eso de cualquier persona, si fuera arreglado, una cosa muy discusión, no sé. No digo que Andrea lo haya hecho, o sea, lo haya hecho mal o que no lo haya apoyado, lo que sea, pero sí que es verdad que no sea.
These are just a few of the things you can do. So long as you don't come into contact with your partner's blood or cum, then it's safe for sex. And using a condom when you screw or get through helps dramatically reduce the chance of giving or getting HIV.
So the sound's not very good, but it's just a very similar approach, but just using words like cum, fucking, use a condom when you screw or get screwed, like just using the kind of language that people themselves would use. Just having a kind of sex positive, very open approach, which is interesting. Obviously, there was loads of backlash to this video. It went straight to VHS and had only a few copies of it were created. So 1995, this is just a newspaper clipping that we found that's based in Leeds.
Yes, a lot of these are from the Yorkshire in Perth. But yeah, So the council provided people with HIV virus a permanent team of specialist carers to improve their quality of life. So that was still prior to kind of more effective treatment.
Yeah.
Still trialing things.
Yeah.
So yeah.
Yeah, and like ostensibly very informative, but still think phrases like sex warning, HIV toll, so still kind of
And through sexual intercourse between men.
Yeah. And so
again, some more from the Yorkshire Evening Post, AIDS peril of the pleasure seekers. So anybody who's going to have sex more than once or twice, or for other than, yeah.
Yeah, this linking HIV still to like debauchery and pleasure, and it's interesting. It says there's this subtitle: "Survey reveals disturbing trends in youth culture." So like this conflation of sex with danger and risk and death, but also young people as well. I still get that a lot on a stall. I was at Rochdale Library in Greater Manchester recently, and someone came up to me and said, "Oh no, you don't need to be here. You need to get down to the college. They're the ones having the sex. That's where the chlamydia is," and stuff like that. Which, on the one hand, you can see where they're coming from, but people look always very surprised when you say things like the highest rate of people being diagnosed late with HIV is in the over 50s, for example. So just this assumption that older people don't have sex or aren't at risk. You know, still tackling that every day, really. So now we're going to get on to my favorite bit, which is talking about community activist responses to the crisis, because governments were very slow. Money did start to come in. We saw things like Terence Higgins Trust. In 1985, they got their first kind of government grant. And in 1990, we had MESMAC in Leeds, which was government funded. But things weren't happening fast enough. And there was this global activist movement called ACT UP, which stands for AIDS Coalition to Unleash Power. And that was global, and it had a Leeds contingent, which you can find the full talk on the West Yorkshire Queer Stories project. The full interview, if you just go on there and type in ACT UP Leeds, you'll find it. There's also a talk on YouTube that Mick Ward did, one of the founders of ACT UP. That's this person here on the left. Mick's got a great talk on YouTube, which kind of like details all the different actions that ACT UP did, in the ways that they were successful or not so successful, and outlines the way that ACT UP were always very much committed to direct action, not kind of waiting for governments to do things, but just go.
Well, it had to be, because the government were so inactive. So it was people like ACT UP were crucial in getting treatment pushed forward and drawing attention to the fact. Do you want to move on to some of the slides?
Yes. So this is one of the early actions that ACT UP did against Texaco, the kind of oil company. They made it a policy that any of their workers wanting to access health benefits had to take an HIV test before doing so. So ACT UP responded by literally going to the oil pumps, disrupting it, putting signs on all of the oil pumps saying out of order, things like that. And going to the offices in Canary Wharf in London and occupying that space, just putting their bodies there. They were actually only inside for about 20 seconds before Texaco's own security guards kind of threw them out. They didn't have to wait for the police. So yeah, that's Nick there, you can see. And so just being very loud and very visual. ACT UP was all about being very bold and bright and visible, because obviously this is like before the internet, things like that. Yeah. Do you want to say anything?
Yeah, it's what slides
next. Oh yeah.
So this was a fantastic one, because obviously people were having sex in prison, but there was no acknowledgement, or there was complete denial that anything like that was happening, but people were getting HIV and stuff. So there was a thing where they were throwing condoms over the wall into Armley. They were kind of floating them over in helium balloons, trying to burst them so the condoms would land. but it was really hard. Obviously, it's a lot harder to hit a helium balloon as it's flying over Amry Prison than. So where they ended up, I'm not quite sure. Probably in your grandma's garden.
Yeah.
So, but yeah, like I say, on the West Yorkshire Queer Stories, there's a few other kind of stories of their kind of great ideas that didn't quite work. So yeah, what's another slide? That's not very long enough.
Oh, okay. Yeah, one just important thing to say was that they were very effective in actually getting meetings with people, and that was because of the protests that they did. Yeah, so they always just kind of hit very swiftly and visibly and loudly, and that would then help them get a meeting with someone to then help them like renew their policy or something. And this, so as well as doing actions, they also obviously every year there was World AIDS Day on the 1st of December, which was to remember people that had died. But they wanted to turn that into more of a protest. So between the years of 1988 and 1995, they always held marches on those dates. And this is a great picture. So there's massive thank you to Jill and Mick who supplied this to the West Yorkshire Queer Stories project, and means that we've got it here now. And
bizarrely, it's more or less outside Skyline's front door.
Yeah.
Just the Bank of whatever Scottish Life, that is now the Cafe Nero. Yeah. Yeah. At the end of one of their marches on World AIDS Day, Mick stood on a kind of bench to say something, which kind of singled him out as the kind of leader, and the police came and arrested him and took him down to Millgarth Prison, which is where John Lewis's car park is now. Which Andy told me earlier. It was not there anymore. And the first thing they asked when they brought Mick in was, "Do you have AIDS?" And Mick said, "I'm not going to answer that." And they said, "Do you have HIV?" He said, "I'm not going to answer that." So they then, everyone in the station, even the police that, people that weren't going to talk or touch Mick or would far away from him, they all donned rubber gloves and other kind of protective gear. And so ACT UP in response organized a march, and they went out and purchased loads of like industrial rubber gloves, which, and you were here? Yeah, I was there. Yeah, get your gloves off our bodies.
Shout and get your gloves off our bodies. And because of this, we're able to talk to people in Millgarth and tell them that they didn't need to do that. And apparently there was a party afterwards, which I would think is really interesting. You get films like 120 beats per minute, and even It's a Sin, actually quite recent, where it kind of shows this kind of dual aspect of like the devastation and the loss, but also the fun that people would have as well. Andy, you sometimes talk about remembering at the time seeing people in clubs who were
you'd be dancing in clubs and guys would take their shirts off and they would be covered in KS legions over their body, but they were, then they were going to die. They were dancing for their life, kind of thing. So yeah, it's quite wild. Yeah.
One outside the
art gallery.
Yeah, which is still where people protest to this day, where people gather.
So Skyline took over kind of HIV support services in Leeds in 2007, and still continues to this day supporting people. We see people, as you all know, we see people from across every walk of life. We've got roughly, I think, 200 clients in our books. I think there's 2,000 in Leeds, Jen? 2,500 clients, positive people living in Leeds. So yeah, and stigma is still a massive part of that journey kind of thing. So we do support people with that. So, fortunately now you are able to be a lot more positive about their life outcomes because of treatment and things. And some people, they have early interventions and they kind of get on with it quickly. Other people need you know, a lot more input. So everybody's journey is, you know, as people is incredibly unique.
Yeah.
So
it's been quite hard to find figures for just how many people died in the UK for various reasons. I've read one thing that said 20,000 altogether, but there's a book called The End of Innocence by Simon Garfield, which was written in 1994, and by that point, by his calculations, there was just over 10,000 by 1994 that had died.
it's such an hard, because I even wrote to Public Health Leeds trying to get figures for Leeds, and they couldn't tell you, or they wouldn't tell me. They said, you know, most of it was kind of not documented as a HIV or AIDS death.
Yeah, Michael.
Yeah, understandably, because then it'd affect people's life insurance and all sorts, wasn't it? Yeah. And they kind of, again, to do with the stigma of kind of with the family.
Yeah.
So
there's one story that Mick talks about in his presentation about ACT UP, and he says that there was one, I think it's called Simply Health, something. Yeah. So they wouldn't pay out. It's like an insurance. Yeah. Really? Yeah. Maggie said, if you didn't hear, they changed their name because of ACT UP's action. They wouldn't pay out for someone who had died because they said that he'd died from AIDS, which was self-inflicted. So yeah, they wouldn't pay out. And ACT UP had a long campaign against them, and with help from trade unions as well, helped them change that policy. Yeah, and yeah, Michael, in the report that we got from Michael Waugh, he said it's, you know, it's really hard to state because people didn't want it on their death certificate, and also he doesn't have any access to any of the records of patients because it's all confidential.
this was pre-COVID, so it's when they were kind of introducing testing within at the LGI as part of your A&E appointments. It was if you were getting bloods done, they would automatically test you, and it's an opt-out service. So, which then stopped, which I think they're in talks about restarting. There's talks. Yeah, which then brings us on to our final slide. So this was literally 2 weeks ago. There was a big meeting at the town hall with various organisations as ourselves. There was MESMAC, there was Brotherton Wing, Leeds Sexual Health, and it was talking about Leeds has joined this partnership to become one of the fast track cities. So that is trying to end all HIV transmissions, or this kind of 95% down by 2030.
Yeah, it's something that the UK government as a whole committed to in 2019. Manchester, where I'm working, was already part of this, and this is our big target that we work towards, ending all transmission routes, all HIV transmission by 2030, which we are currently on target to achieve in Manchester. And it's getting 95% of people to know their status and get them their status, their viral load to be undetectable so that they can't pass it on. And Leeds joined a few weeks ago. Yeah,
it was a national, I think it was a national thing that was happening a few weeks ago, but there was a big thing in Leeds a few weeks ago.